Next up, a session created by our Underwriter, the National Council for Behavioral Health. So please welcome the National Council's Vice President of Addictions, Becky Vaughn. She's here to share the story of two mothers. Becky?
Thanks. Good morning. Did she say, and now a word from our sponsor? Is that what she said? I may have missed that part. No, good morning. I am Becky Vaughn, Vice President for Addictions at the National Council, and we are thrilled that Atlantic is using their considerable voice and influence to really bring national attention to these critical issues. Now, some of you are probably wondering, who is she and what is she doing up there? Actually, I'm kind of wondering the same thing. I mean, we've had senators and we've got secretaries going to be here, and Sir Richard Branson, for heaven's sakes. So, you know, and then some of you may have even read my bio, and you're wondering, and you're actually distracted by the fact that somebody who's been in the business for over 35 years, how could she possibly look that young? So I want to assure you that, you know, this is going to be brief and everything's going to be good, but I am really excited to be here. In all of those years that I've been working, I've worked closely with prevention and treatment providers across the country. These are the very passionate, committed people that are really the superheroes of their communities. And because of that, I've got stories. And today I want to tell you the story of two mothers. Susan lives in Georgia, where I'm actually from. She has a 15-year-old son, and she noticed that he's been extra thirsty and unusually itchy skin and even dry mouth. She's not sure what's going on. She kind of looks online, posts something on Facebook. She has some friends respond, and she begins to realize that the issue might be diabetes. She takes him to the doctor, who immediately knows the procedures for diagnosis and treatment. Her insurance pays for the diagnosis, for education, for treatment, even for support. Susan is devastated that her son is going to have to learn to manage a serious chronic disease for the rest of his life. But her friends have rallied around her. She's even found an online group of other mothers who are experiencing the same thing. Pam lives in Indiana. Pam has a 13-year-old daughter. And she's noticing that Pam is not quite as concerned about her schoolwork or her appearance. She rarely brings home friends anymore, and they seem to be fighting all of the time. But Pam kind of chalks it up to teenage behavior and raging hormones. But as things get progressively worse, Pam begins to wonder if maybe her daughter might be using drugs. Now, Pam can't turn to her friends, because after all, kids who use drugs have bad parents and come from dysfunctional families. When she Googles it, it's more confusing, and it makes her worried even more. So she takes her daughter to the pediatrician. Now, she's not really been trained in how to recognize the signs and symptoms of drug abuse. Even when Pam pulls her aside and says, "I'm worried, I'm concerned that she might be using drugs," the doctor doesn't really have many resources to offer her. She turns to her insurance, more confusion. She can't tell what they cover, if anything, and certainly who the providers would be for somebody like her daughter. Meanwhile, her daughter is now in full crisis. She's moved from experimental abuse to full addiction. Pam doesn't know what she's facing. She doesn't know where to turn for help. And she really doesn't know how it can all be paid for. You know, I want to live in a country where those two mothers are treated equally, where they both have the knowledge and the resources to take care of their children, that they have access to quality care so that they grow up to be healthy. So, how do we do that? Where do we go from here? It's evident by the people that have been on this platform and will be on this platform that it's going to take a broad array of groups who continue to bring attention and action to the crisis of addiction in this country. That's the only way we'll begin to see these two mothers' experiences start to come closer together. So why am I here? I'm here to urge you and anybody else that'll listen to me to take action in 3 very specific ways. Advocate. Advocate nationally, at your state level and local level, to make sure that we have prevention policies and programs that reach every child and adolescent across the nation. That we have quality treatment for mental illness and addiction in all communities, the full continuum of care. And that we have a safety net that is made out of a fine mesh to catch all people and important required services that aren't covered by insurance. Secondly, I'm sort of assuming that most of the people in this room probably have health insurance. But have you looked at the behavioral health section of that health insurance? Have you looked to see if it offers that full continuum of care? If it has an adequate network of providers that understand what it means to offer evidence-based care? And if it doesn't offer that same robust benefit package that you have on the medical and surgical side, then I need you to push your insurance company and I need you to push your insurance commissioner if necessary. We have parity laws that need to be enforced so that people like Pam, who deserve the same benefits as my friend Susan in Georgia, can access those services. And finally, take the lead on educating yourself and everybody in your community with programs like Mental Health First Aid that help people understand what these diseases are, how you can support people, how you can intervene and ultimately save lives. We've trained over 600,000 people, even First Lady Michelle Obama. We're going for 1 million. This type of education should be just as common as first aid and CPR. Do the people in your organization or your business, do they know how to respond to someone in crisis? Or is it scary, awkward, not sure what to do? If they don't know what to do, why not? These are the ways you can take action. National Council members work on the front line every day, providing prevention services, treatment services for addiction and mental illness. In very difficult situations, in underfunded environments everywhere. We at the National Council support them with advocacy for strong policies and also for adequate funding. We also provide training and initiatives that will help raise the quality of services that are happening around the country. And finally, we educate the public with programs like Mental Health First Aid. You're my hero already. You took an interest and you're taking the time to be here today. And I want to thank you in advance for the actions that you're going to take as a result when you leave today. Again, thanks for being here. We appreciate your support.